Hi, Assalamualaikum warahmatullahi wabarakatuh everyone. In this video, I would like to share about one syndrome that not really familiar in our society, which is Tourette syndrome. Tourette syndrome is a neurological disorder that involves repetitive movement known as motor tics or unwanted sounds, vocal tics that cannot be easily controlled. And do you guys know who is pioneer of movement disorder? He is Cardiac Albert Tourette Tourette. He is a French neurologist. This syndrome usually occurs in children between the ages of 7 and 10, but they can begin as early as 2 years old or as late as 8 years old, and much more common in boys than in girls. Now, what are the symptoms of Tourette syndrome? Tics are classified as into two categories. First is simple tics, which is sudden, brief, repetitive movements that involve a limited number of muscle groups. They are more common than complex tics. And second is complex tics, which is distinct, coordinated pattern of movements involving several muscle groups. This is example for common motor tics seen in Tourette syndrome in simple tics. And for complex tics in common motor tics, there are touching or smelling objects, repeating observed movement, tapping in a certain pattern, obsessive gesturing, bending or twisting, and hopping. For common vocal tics seen in Tourette syndrome, for simple tics, they are grunting, coughing, throat clearing, and barking, while in complex tics, they are repeating one's own words or phrases, repeating others' words or phrases, and using vulgar, obscene, or swear words. There is 5 important criteria that used to diagnose Tourette syndrome. First, both motor tics and vocal tics are present. Second, tics occur more than a year. Third, tics begin before age 18. 4, tics are not caused by a medication or other substance. And 5, tics must change over time in location, frequency, types, like complexity or severity. And now, what the cause of Tourette syndrome? The factor is the interaction of multiple gene variations. It occurs abnormalities in certain brain regions, including the basal ganglia, frontal lobes, and cortex, and the circuits that connect these regions and the neurotransmitter, dopamine, serotonin, and norepinephrine, and they are responsible for communication between nerve cells, called as neurons. And now the treatment for Tourette syndrome. There is no cure for Tourette syndrome. Treatment is aimed at controlling tics that interfere with everyday activities and functioning. When tics are not severe, treatment might not be necessary. First is medication. Medications to help control tics or reduce symptoms of related conditions include the below. And for therapy, there are some therapy that can be used to help them. First is behavior therapy. Second, psychotherapy, and third, deep brain stimulation, called as TBS. That's all from me. Kamsahamnida.